Good morning, I'm Ann Schindler. On today's First Coast Connect, with the City Council poised to make significant cuts to proposed healthcare spending, how will the community be impacted? 3 healthcare CEOs explain why they're worried about Tuesday's vote. Then, political season kicks off on the First Coast. We introduce you to Congressional District 4 candidate as he launches his campaign here on the air in just a few minutes. And a love letter to beer in a pictorial history of brewing in Jacksonville. Join the conversation. Give us a call at 904-549-2937. You can also email firstcoastconnect@wjct.org or tag us on social media. It's all ahead this hour after the day's news.
Live from NPR News in Washington, I'm Windsor Johnston. President Trump and the First Lady arrived at Windsor Castle this morning, where they were greeted by King Charles and Queen Camilla. They joined the royal couple in a carriage procession through the castle grounds as a military band played. NPR's Danielle Kurtzleben reports today's pageantry marks the start of a 2-day state visit.
Trump is being greeted by members of the royal family during this state visit with a welcome involving military bands, a flyover by both UK and US military jets, and a banquet at Windsor Castle. On day 2, Trump and UK Prime Minister Keir Starmer are expected to sign what they're calling a tech prosperity deal, a partnership across the areas of AI, quantum computing, and nuclear power. The two men are also expected to talk about foreign policy, including Ukraine. Starmer is one of the European leaders who has been pressuring Trump to support Ukraine more in the war Russia started. The day of spectacle goes hand in hand with these more serious discussions, as UK leaders potentially use Trump's admiration for the royals to get policy movement. Danielle Kurtzleben, NPR News, London.
Former President Barack Obama is weighing in on public discourse and American democracy following another high-profile act of political violence. Ryan Zunner of Buffalo Toronto Public Media reports on Obama's remarks in Erie, Pennsylvania.
Conversation from the 44th president at the long-planned speaking event quickly turned to where the nation is at following the shootings of conservative commentator Charlie Kirk and 2 Minnesota state lawmakers. Obama condemned those acts as heinous and said the free exchange of ideas and dissent is in danger. That connected with the 8,000-person crowd, including attendee Lynn Pearson.
Respect other people's differences and be able to make sure that we recognize people as humans and not just who their political party was.
Obama criticized the Trump administration for focusing in on the accused Kirk shooter's possible ideology, calling it a tool to, quote, silence debate on where we are as a country. For NPR News, I'm Ryan Zunner in Erie, Pennsylvania.
A biotech company in Texas says scientists have made an important advance toward bringing the dodo bird back from extinction. NPR's Rob Stein has more.
The dodo was a flightless bird that went extinct hundreds of years ago. Colossal Biosciences says company scientists have been able to grow something called primordial germ cells for pigeons for the first time. The company hopes to genetically modify the cells to someday produce a dodo-like creature. The cells could potentially also be used to help save endangered birds. Colossal is trying to bring back versions of several extinct creatures, including the woolly mammoth and saber-toothed tiger. Rob Stein, NPR News.
This is NPR News in Washington.
Good morning. You're listening to WJCT News 89.9 in Jacksonville. I'm Stephen Ponson. It's now 9:04. JEA is holding a senior resource fair today until 3 to share tips with customers about saving money on their utility bills and provide information about community resources. Other agencies represented at the free event will include the city's Community Outreach and Property Appraisers Departments, JTA, ElderSource, and more. The event is at JEA headquarters on North Pearl Street downtown. There will be validated parking at the courthouse parking garage on Clay Street. At least one Florida school superintendent is taking issue with the state's response to social media posts by public employees. Florida's education commissioner is taking steps to identify and sanction teachers who have posted what he calls despicable comments about the death of conservative activist Charlie Kirk. Education Commissioner Anastasios Kamutsa sent a letter to the state's superintendents last week directing them to forward his message to all instructional staff. Leon County School Superintendent Rocky Hanna says the State Department of Education has become the gotcha police.
They're constantly looking at social media posts, looking at newspaper clippings, and calling just to try to put either me in a compromising position as superintendent, or our teachers a compromised position as classroom teachers. And it's uncalled for. And there's no reason for it.
In the wake of Kirk's death, many public employees in Florida and other states have been fired or suspended for their comments about Kirk's killing. Mostly dry this afternoon with warm temperatures.
Support for NPR comes from NPR stations. Other contributors include Imaginable Futures, envisioning a future where learning sparks opportunity and thriving belongs to everyone. Learn more at imaginablefutures.com. And the listeners who support this NPR station.
Support for First Coast Connect is provided in part by Baptist Health and North Florida TPO.
Good morning, I'm Ann Schindler, and this is First Coast Connect. Today, will local healthcare budget cuts cause permanent injury? We talked to 3 healthcare CEOs ahead of a city council budget meeting on Tuesday. And in just a bit, we'll introduce you to one of the first local candidates of the 2026 season as he announces his bid for Florida's Congressional District 4 seat live on air. But first, a consequential city council vote looms Tuesday with millions in possible cuts to proposed healthcare spending. Here to talk about it, we're joined by Jennifer Ryan, CEO of Volunteers in Medicine. Good morning, Jennifer.
Good morning.
Mia Jones, CEO of AGAPE Family Health. Good morning, Mia.
Good morning.
Angela Strain, CEO of We Care Jax. Good morning.
Good morning.
So I'm going to start with you, if I can, Angela. The council initially cut from the mayor's proposed budget $3.77 million on healthcare spending. Some of that has been restored. Catch us up a little bit on where we are in terms of restoring funding, what's happening on that front, and what is going to be happening Tuesday night.
Thank you so much for having us this morning. One of the biggest cuts, of course, is to our collaborative of free and charitable safety net primary care clinics. Under the Curry administration, under President Freeman's mantle, they added our safety net collaborative to the strategic plan of the City Council because it is working for the community. Previously, they were funded at $166,000 a year. They were reduced to zero, but fortunately, we were able to see $45,000 of that restored, but that is still a significant cut. That's huge.
These are 6 providers, and we have representatives from 2 of those 6 here today. We'll be talking about the work that they do, but basically, the funding for each of those 6 providers was initially cut to zero.
That's correct.
And basically a quarter of that has been restored.
Correct.
And that's just one part of this overall budget, picture when it comes to healthcare. Talk a little bit about the work that We Care Jax and the Jax Care Connect specifically does. Jax Care Connect is sort of I think you described it as a front door that sort of brings people in, helps them access healthcare, but also get over some of the hurdles that might prevent them from accessing healthcare.
Absolutely. So this Duval Safety Net Collaborative is 6 of our safety net clinics and We Care Jax. For more than 30 years, We Care has been the advanced diagnostic and specialty care network for our safety net. We are able to provide support for patients with no cost to the patient or their family when they need an MRI or they need to see a cardiologist or a pulmonologist. Our primary care clinics, they are the captain. We make sure that every patient is having a wellness visit a minimum of once a year. When they come to us, that is one of the requirements. Our safety net clinics have been incredible. One of the things we found in years of study together is that with 900 square miles of a county to cover, many times our uninsured neighbors, of whom there are over 100,000, they often didn't know how to connect to our primary care clinics. They didn't know geographically what was the right one. They didn't know, based on their income, which was the right one, or the complexity of their need. And that meant they found themselves often in an emergency room for a condition that really should have been covered in primary care. Jax Care Connect was the result of that study. And as a collaborative, we launched a pilot for 3 years. At the end of that pilot, with our Jax Care Connect patient health advocates, we saw that 60% of patients did not return to the emergency room for a full year. And moving forward, we're now in an operating program with Jax Care Connect, and that percentage has actually gone up to 76%. So it is a working solution for our community, and it is the front door to the safety net primary care world.
You talk about, the issue of bounce back patients. There was a recent meeting where a number of people from the medical community and the advocacy community spoke to the city council asking to restore some of those funds. And one of the people that spoke was Dr. Mario Paludo, who's the chief medical officer of Ascension St. Vincent's. Let's take a listen to what he had to say.
The benefit of their survival and long-term benefit is not measured in the interventions performed exclusively in the hospital. The larger benefit comes when you start to have medication compliance as it relates to your diabetes care, as it relates to your post-heart attack care, and we have the medication compliance to support your stent not clotting off some days later. These are real cases and real examples that we see, and unfortunately we see the returns to the acute environment in the ERs and in the hospitals when these patients come back without access to care.
And so the clinics can help people, access the care that they need. This issue, though, of preventing additional healthcare complications because somebody's discharged from the hospital and perhaps not getting the follow-up care that they need can really undo whatever services that they've received already. Mia Jones, is that something that AGAPE Health sees, works with patients on?
We do. Patients can come to us whether they're insured or uninsured. Oftentimes, when they do come to us, they are in a place where they are far more progressed in whatever their illness is. They're not just coming for an annual visit most of the time. They are coming because something is wrong and they need help. And so what we find is we get referrals from the hospital for those who don't have primary care, and we will work with them, especially those chronic disease patients, to make sure that they stay out of the hospital, but to get that care and that education to understand what it is that they're living with and how they should best live with it.
There can be, people have complicated lives and health can really complicate someone's life, but often that comes on top of other challenges people might have in terms of accessing medical care just via transportation or having the right food to eat to make sure that they're living, having a diet, for instance, if somebody has a diagnosis of diabetes so that they're able to eat appropriately. How do you find those additional hurdles impact people that you're caring for?
They are very difficult for the patients to overcome. And with the cuts that we're finding across the board, it's going to be even harder. So we partner with Feeding Northeast Florida, and we have pantries at our various clinics where our patients can get a prescription for for food, recognizing that food is a part of that medication. And when Feeding Northeast Florida gets cut, the amount of food that we have is reduced, and then our patients don't have that access to those fresh fruits and vegetables because most of them live in food deserts. And because you're living in a food desert, what you're going to find in your neighborhood is the fast foods, the processed foods, and those things that are going to be within their budget are going to be those things that are not healthy for them. And so all of those pieces become hurdles that they have to cross, and then it creates for them just more issues that they have to deal with. And so we work collaboratively within the clinics. We work across the nonprofit sectors in order to try to create an environment for our patients that when we know that transportation is an issue, then we work with them to get them where they need to be. We know if we can get them to the right place the first time, we're saving money for the entire community. And so whether that's the right clinic, whether that's the right nonprofit organization, we know that when we listen to the constituents, we're recognizing that, okay, there are things that they need. We don't need to give them what we think they need. We need to give them what they actually need so that we can save ourselves money.
Jennifer, I want to ask you about volunteers in medicine. That's one group that is one of these 6 safety net providers. Funding is being cut from what was proposed in the mayor's budget. We said a quarter of what she's proposed is basically is what's on offer. I wonder if you could talk about the need, because some, health proposals that the mayor has remained flat in terms of their funding, as others have seen cuts. What are you seeing though in terms of the need? I know that you have talked about, for instance, some new state laws that have impacted patient load, and a new requirement that basically, hospitals have to provide an outpatient discharge plan that involves aftercare, which is a great thing, right? But it does change the landscape for providers.
And there's a lot going on to impact the increase in patients we're going to see. And that is one of the major ones. And we're very proud to be one of those places that our hospitals see that they trust to take care of their patients after they leave the emergency room. So there was a bill passed that went live last March or this past March. So we've been seeing an increase. So these city funds would really, really help us. In addition to that, we're seeing changes in who qualifies for Medicaid. We're going to see changes in the subsidies to the Affordable Care Act. There's a lot of people that are going to be in need of health care. And so we're also a part of Jax Care Connect, where we're being referred patients through that. That's also a direct conduit from HealthLink Jax, which is a city health initiative to increase access to health care. So we're all seeing these increases from all different angles. So the funds really would help us tremendously. But I will say a lot of us, we're nimble and we will do what we can because we are relevant to our community. So one of the things we do at Volunteers in Medicine is we have volunteers and they are committed. We have 300 a month. And so if we don't get this funding, I'm going to rely more on volunteers. And they're actually willing to step up and help more because they truly believe in what we're doing to keep people working, to keep them healthy, and to keep them out of emergency rooms.
If you're just joining us, we're talking to 3 local healthcare CEOs about the impact of proposed budget cuts. You can join the conversation by calling 904-549-2937. You can also email First Coast Connect at WJCT.org, or you can reach out on social media. Angela, I want to ask you about what Jennifer mentioned, which is, the federal landscape and how that's changing. We know that the proposed cuts that have been part of the big, beautiful bill that was approved is there are already a number of uninsured people in Duval County, but there are about more than 200,000 people who are on Medicaid and 164,000 people who receive their insurance through the Affordable Care Act. All of those people expected to be greatly impacted by major cuts to these federal programs.
That's right. The Centers for Medicaid and Medicare tell us that Florida is going to be losing roughly 4 million across the state. The Affordable Care Act, there are some projections that premiums are going to go up about 75%. We know the population that we work with, they are living often paycheck to paycheck. A change like that will mean that they fall back into the uninsured safety net. One of the things that we want to prevent, medical debt is the number one cause of bankruptcies in this country. And we need to ensure that our patients are going to be resilient at the end of a medical crisis. We work with over 500 physician volunteers who have agreed to see patients at no cost. And last year alone, that meant that they donated $23 million in uncompensated care to our Safety Net Collaborative. Without that, we would have folks who would be in jeopardy of impacts to their credit, things that would then impact their ability to stay housed, their ability to get a new job. Many of the folks we deal with, about 75%, are working one or more part-time or gig economy jobs without access to health insurance. So we know in our community, housing is a high expense. If we keep people healthy, we're going to prevent homelessness, we're going to keep people in their houses, and we're going to keep them in the workforce. And we need that. Roughly 50%, if you take the uninsured, those on Medicaid and those on the Affordable Care Act, 50% of Duval County are at risk of losing their health insurance.
So we've talked a little bit about the good work that you do and why it's important and why it matters to people that are your clients or your patients. But I want to talk about some of the arguments against this funding that have come up at the Finance Committee meetings and that a number of city council members seem why they're opposed to additional funding or why they support cutting the proposed funding. One of those is, this is something that the hospitals are benefiting from. If we're alleviating the ER load, um, or reducing their number of uninsured patients, that benefits the hospitals. The hospitals make a lot of money. Why should the taxpayers of Jacksonville be shouldering this burden to take relief off of companies that are making millions or billions of dollars?
I can share a little bit. So, our hospital system in the local community, when we talk about 23 million of donated health care, 65% of that was from Ascension St. Vincent's last year. The hospitals are in it with us. Baptist Health provides support all the way up to and including MD Anderson Cancer Center care for the uninsured. In addition, when we have our hospitals serving the uninsured, all taxpayers are impacted because those numbers go to Tallahassee, and the hospitals do receive some compensation back, and that comes out of our taxpayers' dollars. So they're in it with us. They're not standing by and hoping that we'll do all the work for the community. They are with us shoulder to shoulder, and that can mean direct funding to our clinics, but it also means that incredibly valued uncompensated care for our neighbors.
Can I add something
Certainly,
to
yeah.
this? I also want to share. You gave the full number of what what was originally in the city's budget, around 3 million, little over. I know for my clinic alone, last year I prevented $26 million in emergency room care. So I think what we're trying to do is not say how important emergency rooms are and how important our hospitals are, but we don't need people living with asthma, with diabetes, with hypertension, utilizing emergency rooms when we can take care of that inexpensively, efficiently at our free clinics and our charitable clinics.
So that is something that also came up at this meeting. Dr. Matthew Thompson, who's the CEO and co-founder of the city's telehealth partner, Telescope Jax, spoke about that and that kind of referred cost. Let's take a listen.
If you're uninsured, you don't feel like you have anywhere else to go, you're going to get a bill for that. The city funds UF Health $56 million a year to take care of people. As a taxpayer, why would I want that money to go towards a $5,000 bill that could have been avoided? I want that money to go to people who have end-stage renal disease, who are very sick, who need surgery.
So, Mia, I'd ask you about that because, a lot of people have said on the council, we shouldn't be in the healthcare business. And there is some evidence that we are, to some extent, in the healthcare business. What is an appropriate level? I mean, some city council members say this just shouldn't be on the taxpayers of Duval County.
What I say to that is that it's really important for us to look at our history here in Jacksonville. Jacksonville is a consolidated city. So that means our city and our county are connected, and we have consolidated so that we could save money. In doing that, every other county around the state funds health care at various levels. We don't do that. Over the years, fewer and fewer dollars from our city have gone into our health care pots. And so it's our responsibility to make sure that the city does their part. They can't say, oh, it's the state. It's not the state. We are a consolidated government, meaning that we are county and we are city. And the county is responsible for putting funds into the pot to make sure that healthcare services are provided within our communities. And when we ignore that, then what we do is we create more problems for us as a community. And what we're saying is we were smart enough in the 60s to say, we know that there's a better way to do this. We shouldn't have money going into the county and money going into the city. We should come together and put those dollars together. We don't need 2 police departments. We don't need 2 fire departments. In doing that, we need to say, we've done some things right. We need to continue to do them right, but we need to make sure that they're properly funded.
Jennifer, I want to ask you because in addition to your work with Volunteers in Medicine, you're also on the board of the Nonprofit Center of Northeast Florida. And we're talking largely here about nonprofit providers, healthcare providers, but the overall nonprofit landscape is also facing a lot of challenges, federal, state, local budgets.
Yeah. So, as part of being on the board of the Nonprofit Center and being a lover of my nonprofit partners, I love the work that we all do together. We are a big part of our community. We are constituents, we are voters. There's over 1,400 nonprofits in our community with a combined revenue of over $12 billion. We're one of the top employers. And a lot of what we're doing is contributing to our communities. We're keeping people in homes, we're keeping people healthy. We're doing a lot with a little. We rely on volunteers. And it's unpopular to think that nonprofits are lazy, are not educated. It is popular to realize that all we all are overseen through Candid, which is a way that measures nonprofits and their success and who's efficient. We are employing people with PhDs, with doctorate degrees. And so I just want to advocate for the work that we do, over 1,400 organizations, businesses, nonprofits are businesses, and we're doing the work, and we do it a lot of times very inexpensively, and it has a huge community impact.
The other point that some city council members have made, and I know that Nick Howland, who's the vice president of the council, has made this point that he says it's a false narrative to say that we're cutting because, in fact, what this budget proposes, the mayor's budget proposes, would increase spending. And so in some cases, they're asking, just hold it steady. Why should we be expanding these programs? And so his point is that it's not budget cuts.
As much as I do respect his opinion, looking at our history, again, these nonprofit healthcare programs were part of the strategic plan for the council. In 2022, there was a 6-month study of the community, the critical quality of life issues. One of the components was specifically around healthcare.
And why was that?
That was because of all of the challenges that we have in our community. We have got just a little bit of information. We have 15% of our community living at or below poverty. That part of our community is desperately in need of support through medical crisis, through chronic disease, through all the things that we know can prevent you from returning to the workforce or to being meaningfully employed. Everyone in our community deserves a chance at a next step. And what our council members may not realize is that study in 2022 found that the work that we were doing in the nonprofit sector was exceptional, and the data is there to back it up. So we were funded in 2023. It is to say now that it's an expansion or we're not going to fund it, it's just not correct.
You mean we're funded in the prior mayoral administration of Lenny
Correct.
Curry? This is not something that Mayor Donna Deegan came up with.
Exactly. And the fact that we have support both from Mayor Curry and Mayor Deegan just goes to show you that these are not political decisions. These are decisions about the local environment. And we believe that our local government, they say all politics is local. We believe that it is up to our city council to ensure if there are cuts at the state and federal level, that they're looking out for our neighbors. And part of that is looking at the history and making sure we're not cutting from the programs that were already put into the strategic plan.
Mia, one of the things that I've heard Angela say at these meetings is that a cancer diagnosis makes a person 2.5 times likelier to declare bankruptcy within 5 years. And so just in terms of family impact, I mean, we've been talking a lot about finances, and obviously declaring bankruptcy is destabilizing, but what is the ripple effect of something like that for someone's family, for their friends, for their community?
What we're finding is, and AGAPE has recently embarked on increasing our behavioral health services. As we listen to our patients, listen to the stories of what they're living every single day. When you start talking about a kid having to hear mom talking with someone and making a decision on whether she's going to buy medicine or whether she's going to buy food, or whether we're going to put gas in the car or we're going to take the bus in order to get around the city that we know is huge. Um, it becomes a lot of stress. It then compounds. So not just that parent is dealing with it, but then our children are having to deal with it. We're seeing cuts in free and reduced lunch. We're going to see additional cuts coming as it relates to food stamps. So every piece of the pie is being cut for our most vulnerable. And then we're giving tax reductions to those who have. And I was raised at a time where those who have gave to those who didn't so that we could all have a better quality of life.
Jennifer, just as kind of a final thought, I mean, this vote is Tuesday. The city council will be deciding this budget at that meeting. What do you suggest people who care about this issue do between now and then?
What I suggest people do is if you are a neighbor to a city council member, reach out to them and talk to them about this. Attend the city council. We're talking about quality of life of our neighbors, of our community. If you are sick, you are not happy. You're not working. You're not going to play with your kids. And what we are doing with this small amount of money is preventing these major crises. We are preventing major emergency room visits. We're trying to provide screenings, provide these inexpensive interventions that, if untreated, are very expensive, are very overwhelming, and are destroying families. So let's just remember we're humans and we all want to be happy and we all want to be healthy.
Well, Mia Jones, Angela Strain, Jennifer Ryan, thanks so much for being here today. Really appreciate it.
Thank you for having us.
All right. Up next, a Jacksonville native, longtime attorney and community leader kicks off his bid for Congress live on the program. Stick around. Thank you so much. Welcome back. After nearly 4 decades as working as an attorney, my next guest is eyeing a career change. Here to tell us about it is Michael Kerwin. Good morning.
Good morning, Ann. Thanks so much for having me.
So, Michael, I believe you have a special announcement.
I do indeed. I've decided I'm going to run for Congress. I'm running in the 4th Congressional District, and that's the seat currently occupied by Aaron Bean.
Okay. So your background is, as we said, a lawyer. You've also worked a lot in the nonprofit and civic space. What makes you want to be a politician?
Well, this year started without that plan in mind at all.
Okay.
There was so much chaos coming from D.C. This year that it gradually caused me to feel compelled to decide to run for office. What I've seen, what we've all seen coming out of D.C. is disturbing. It's not the values, not espousing the values that I believe in, and I think most Americans believe in. And because of that, I felt that we need to make a course correction here. And I feel that I'm fortunate to be at a point in my career where I could afford to do this. And I care very much about the direction of our country, and I want to see us go back to a better path.
So what do you think you could bring to this job that the current office holder, Aaron Bean, is not bringing to his district?
Well, I think The difference that I bring is the experience that I have as a securities lawyer with one of the top firms in the country, helping businesses and individuals solve legal issues and being involved in the community. And I'm wanting to have solutions. I don't believe in running for office solely for theatrics. I believe that what we need are solutions. Well, we're in the midst of a crisis, I believe. Every day for the past 8 months, we have seen chaos. And right now, we are literally that frog in the pot that is slowly starting to boil. We have a president that is acting as a king. We have a do-nothing Congress that is catering to billionaires. And Congress is not addressing the needs of everyday Americans. Our elected officials have divided us to further their political aspirations. They've divided us based upon fear. And so what's happening is going against my values and beliefs, and it's going against the values and beliefs of everyday Americans. We need a Congress that will stand up and do its constitutional duties.
So, for people who are watching our live stream, we're going to throw up a map of District 4, but basically, it is a district that encompasses all of Nassau County, all of Clay County, and then a good chunk of Duval County west and north of the St. Johns River.
That's correct, a slice of Arlington as well.
Okay. And so this is a district that was created in the most recent Florida redistricting, statewide redistricting. It was created, a lot of people believe, to elect a Republican. Previously, there had been some other elements to the district. For instance, the District 5 had been a minority access district. That was also reshaped. And so there is no diversity in terms of our congressional representation in this area. Everybody is Republican. Everybody is a white man. But this is a pretty staunchly Republican district. What is it as a Democrat that you think you would be able to shake loose in that that constituency to get elected?
Well, there's a couple of things I'd like to respond to. Is that the district has been gerrymandered in a way to not only favor a Republican on paper, but also to diminish the voice of Democrats and especially black voters. And I can understand, and I feel for black voters that feel that they've lost their voice, they've lost a representation. However, I feel like I am the best candidate for this job and can represent the people of District 4 the best. I feel like I have got the experience and the willingness to take on the issues and to listen to the constituents and address what they need. If you look at our district, it's considered a +5 Republican district. The Cook report says it's 5% more likely to vote Republican than the average congressional district. But the district is roughly split: a third Democrat, a third Independents, and a third Republicans. Slightly more Republicans than Democrats. And so people are voting because of their economic interest. So many people, especially in the bottom 70% of our country, are feeling like they're being left behind. And so they're going to switch from one party to the next until they find a party that's truly delivering for them. And I think I can deliver, and I think the Democrats will be delivering for them.
If you're just joining us, we are talking to District 4 congressional candidate Michael Kerwin. He just announced his bid for office, and if you have questions or comments as he kicks off the road to November 2026, now's the time. Give us a call at 904-549-2937. You can email comments or questions to First Coast Connect at WJCT.org, or you can tag us on social media. So this is your first time running for office. Your background, obviously, is as a lawyer. You've also done some work with Scenic Jacksonville. You served on the city's ethics commission. What, if anything, about those experiences do you think you would draw on in public office?
Well, I think it's all a seamless web. I think they really help each other and help you understand the community better. Leadership Jacks, in particular, was a great experience. You didn't mention I was a member of their recent class, and Just being exposed to my classmates was wonderful, and then being exposed to the different organizations and issues that the community's facing brings an awareness. And probably every candidate for office should go through the Leadership Jacks training. But Scenic Jacksonville, Riverfront Parks Now, the Ethics Commission have all brought new perspectives to the way I think about things. I think thinking about what goes into quality of life, what makes the day-to-day experience of people in the district better is important to be aware of.
One of the issues this Congress has been criticized for is hyperpartisanship. An ability to work across the aisle is something that seems to have been a thing of the past, really. It doesn't seem very popular to even attempt it. I'm curious what whether you think that's something that you could accomplish. And in that same vein, whether you're in touch with any of the other members of the local congressional representatives, that's John Rutherford, Kat Kamek, or even your opponent, Aaron Bean.
Well, again, that's a great question. It's an important question. I think that for Congress to be effective, it needs to return to the days of working across the aisle. People need to work together. And if elected, I definitely intend to work with the other representatives representing Northeast Florida in making sure that we're delivering the solutions that our community needs, that we are delivering bringing home the bacon, so to speak, to our districts. We have so much theatrics in Congress now. It's not helpful. It's not constructive. It is leading to the divisiveness within the country. And we really need Congress to take a different stance. We need Congress to be the leaders on this point, and we need civility to return to Congress. I feel that my background as a lawyer is going to be very helpful because through everyday negotiations with people with opposite views, opposite sides, bridging the divide, coming to a solution, coming to an agreement has been the key to my legal career. And I believe the same skills will be helpful in Congress.
Sure, but I mean, in the legal profession, there's rules, right? There's kind of a code of conduct that people observe. There are traditions and mores in terms of how lawyers communicate, how you communicate with the judge, how you handle yourself in a courtroom setting. It seems like a lot of the mores and norms and traditions of congressional leadership have changed.
Well, that's somewhat of an indictment of Congress, isn't it? Because Congress has always had those norms and those practices of civility that have led to good solutions for the country. And unfortunately, we've allowed Congress to be hijacked by members that are more interested in getting in front of a microphone, more interested in theatrics, more interested in simply raising money through media clicks, et cetera, on their Facebook or whatever their campaign sites are. And we need to get away from that. And we need Congress to take rules to start policing themselves and basically penalizing their members that get out of line.
We're talking to Michael Kerwin. He is announcing today that he's running for the Congressional District 4 seat here in Northeast Florida. If you'd like to join our conversation, you can call 904-549-2937. We have a call from Wallace in Arlington. Good morning, Wallace. Go ahead.
Yes, good morning. As an avid environmentalist, I'm passionately curious on your stance with respect to our environment. And as a lawyer, I'm sure you understand what, for instance, the St. John's River Keepers is doing and the costs that's involved with them to defend the purity of the St. John's River, but also land pollution and air pollution and so on. What has just recently happened as far as the buses are concerned, the electric buses, money's getting forwarded toward clean petroleum and so on. So I'll take my question off the air. What will you do for us, for District 4 in particular, to help clean up this problem, sir? Thank you.
Thanks, Wallace.
Thank you, Wallace. That's a wonderful question. We have seen a rollback of our country's environmental regulations in the past 8 months, and that's been a tragedy. We need to look at bringing sensible environmental regulations back into place. You've touched upon a number of things in your question there. The cost of pollution, the cost that we all bear, whether it's through climate change, whether it's through water quality, air quality issues, are a hidden cost that we all suffer and we all bear. And so by having sensible environmental regulations, will provide not only a sound quality of life, but a bright future for our children and grandchildren.
Yeah.
Thank you.
Okay. We've got a question from Terry who emailed, are you willing to have an in-person town hall? None of the representatives of Northeast Florida have had an in-person town hall. They filter their groups carefully so they can control the narrative.
That's so sad that that question's being asked. Of course, if elected, when I'm elected, I'll be the representative for everyone. And I believe town halls are a great practice. I want to hear everyone's views, whether you're a Democrat, Republican, or independent, whether you agree with me or not. People can change their minds. That's the whole point of having discussions. That's the whole point of having these town halls. And I think I know most of the issues, but I'm happy to have someone convince me that a position should be changed. And I think that needs to be welcomed in our practices.
What do you know about running for office? Have you been talking to people that have gone through this process? What are you expecting? What is your plan in the next, months and year?
Well, I've been talking to a lot of people, and a lot of people have thoughts and opinions, and it's been a fun experience so far. And I think the coming year will be an enjoyable experience. The next 4 to 5 months, I really plan to go on sort of a listening tour as far as meeting more people and hearing what the issues are that people in the district have. I believe I understand and know what the issues are, but until you're out there and meeting people, you never really know for sure. And it's sort of a confirmation process going through. And I'm hoping to introduce myself to the district and allow people to understand what I have to offer, and hopefully allow them to gain the confidence that they can trust me and that I can deliver the solutions that they need.
Is this going to be a full-time job for you, campaigning and then office holding?
It is. It is. I retired from my legal practice yesterday, and so
Congratulations.
well, thank you very much. And so, starting today, I am full-time on the campaign trail.
Okay. So where can people meet you if they care to meet you? What kind of opportunities will they have? Where will you be going that will make you accessible to people that are interested in asking more questions?
Well, we're still early in the campaign, so we haven't got the schedules all figured out at this point. But you can reach me through my website, which is votekerwin.com. And there's a way to ask questions, provide comments, and I'm sure we'll come up with a schedule for events in the near future.
And the election is November 3rd, 2026.
That's right. And there could be a primary, and that'll be in August.
Yeah, and I think we would expect a primary. There are a few other names that are in the mix, including Ricky Knowles, Brittany Robinson running as Democrats, Ronald Sherhard, who's an NPA, no party, and Todd Schaefer, unaffiliated. But it's great to have you on this morning, Michael Kerwin. We appreciate you making your announcement here, and thanks so much.
Well, thank you so much for having me, and this is a great way for any campaign to start, so I'm most appreciative. Thank you.
All right. Up next, a new book about the history of brewing in Jacksonville and one of the worst beer ads in history.
The Jacksonville Children's Chorus is holding auditions for kids in rising 2nd through 12th grades. No audition required for younger kids. Rehearsals in Duval, Clay, and St. Johns counties with tuition scholarships available. Information at jackschildrenschorus.org.
Northeast Florida is losing tree cover. Join us September 17th for ADAPT State of the Canopy, a discussion with local officials about their response. Register for this free event at wjct.org/events.
Congress has overhauled the federal student loan system. Students could now have more access to private educational loans, but education finance experts say they're not necessarily a better option.
Private loans that exist now are not particularly working out well for folks. So if we're driving people to this market, what does that actually look like for everyday borrowers?
The pros and cons of the private student loan industry. That's on the next On Point.
Today at 11, here on WJCT News 89.9.
Hey, it's Peter Sagal. You may already know that Congress has ended federal funding to public media, but no matter what's happening in Washington now or in the future, this station's best bet is you. Making a donation, that's great. Making a monthly contribution, even better. Knowing we can rely on you helps in uncertain times. Take control of this station's future. Become a sustaining member today. Here's how.
Visit WJCT.org/radio and thank you.
50 years ago, President Nixon declared war on cancer.
More people each year die of cancer in the United States than all the Americans who lost their lives in World War II.
Now the country's extensive cancer research system faces the impact of steep funding cuts from the Trump administration. What that means for decades of advances in cancer research and treatment. Next time on 1A.
Today, starting at 10 on WJCT News 89.9.
Welcome back. Well, he's the author of several books, but his latest project is arguably his most fun. The book is called Brewing in Jacksonville, and here to tell us about it is Andrew Nichols. Andrew, thanks for being here.
Thank you.
So this book is called Brewing in Jacksonville. It's the story of beer in Jacks. Tell us a little bit about the beer scene in Jacksonville over the last, 200 years.
The beer scene, it started out a little slow. Back in the 19th century, there was one brewery called Eggenweiler in La Villa. That was one of the only ones. It just started out slow. In my book, I have a lot of photos of bars and saloons to make up for that.
A lot of cool photos.
Yes. And it wasn't until the 1910s when the Jacksonville Brewing Company made the scene, which started to really show Jacksonville was a big deal. And
Bay Street was really hopping. I mean, one thing that's so cool about this book is it shows this really thriving city.
Yes.
And Bay Street was a big part of it. One of the bars there was the Onyx Rail Bar, which claimed it was the oldest bar in the South. I had not heard that claim to fame.
yeah, I did not expect that either after researching it. That was an interesting one. And the other thing about that one is the bar itself is said to be carved out of onyx stone. Uh, but that it closed in the 1970s. That was like probably my favorite photo out of all of the bars.
The interior of the Onyx
The,
bar.
the interior, yes.
Yeah.
I love that photo.
And I think we have some photos that we'll be showing from the book that kind of give a flavor of just the variety of pictures and the variety of bars. One thing that you write about in the book is this Schlitz ad campaign
Yes.
that went terribly wrong from the 70s. I had never heard of it before.
Yeah.
Tell us what the slogan was.
It was along the line of drink Schlitz or I'll kill you, which is very,
Wasn't well received.
it's not, it was very off-putting, very bold, did not work, and now no one really drinks Schlitz.
Yeah, well, it I guess was a learning experience. Drink Schlitz or I'll kill you.
Yes.
Maybe not the best way to sell your beer. So you also chronicle the rise of the craft beer business in Jacksonville, which actually started in the 90s with a restaurant bar that's no longer around.
Yes, River City Brewing Company. essentially started. There was also Ragtime Tavern, uh, River City Brewing Company was pretty much, I'd say, the big one. It closed a few years ago and it's gone, and that's one I miss the most. Very unique uh, place
Yeah.
on the river.
But it left a
Yeah.
legacy, and there have been many, many craft brewers to come along since then. And you really chronicle that evolution over, I guess, the last 20 years where it became very popular. There's a lot of places that opened, and surprisingly, when I was reading this, a lot of places that have closed. What's going on there?
Yes, it is somewhat bad timing because of COVID is a big factor. The market is saturated. The market is changing. People are drinking less, and a lot of the breweries just could not handle the costs, the rising costs, the interruptions in the supply chain, and so it was, I believe it was around 6 that closed in the last
Because of the pandemic.
5 years, roughly. Yes.
Yeah. And so you are a fifth generation Jacksonville native. You're the author of other books about Jacksonville's history. I'm guessing this was a pretty sweet research topic. Tell us a little bit about your process. Was this, did you get to sample all the beers? Do you have a favorite beer?
Yes. It was a fun project. Go to all the breweries. Sometimes my friend Edward would come along with me. My favorite beer, I like the John Boat Ale from Intuition Ale.
John Boat.
Yes.
That's a good beer.
Yes.
Yeah, but I mean, this was a passion project, or did you
It,
have a compliant publisher that was like, sure, go drink all the beer in Jacksonville?
well, I saw that there were other books, brewing in, I call it the brewing in series, such as Brewing in Seattle, Brewing in Milwaukee,
Uh-huh.
and Jacksonville did not have one. And that's just sparked an idea of maybe it should have one. And then there was also the Jack's Ale Trail, which is you get a little passport, you go to a brewery, you get a little passport, you go to every brewery, and you get it stamped. And
It's also a fundraiser.
yeah,
Yeah.
yes. And I kind of thinking, what if I made something like that into a book, somewhat, which is one chapter with all of the craft breweries.
Well, it's called Brewing in Jacksonville. Andrew Nicholas, thanks so much for being here. Appreciate it.
Thank you.
All right. And thank you for listening. If you have questions or comments, you can send either to First Coast Connect at WJCT.org. And if you missed anything, you can catch our rebroadcast tonight at 8 or find our entire archive on your favorite podcast platform. On tomorrow's show, we talk to the organizers of the Undiscovered Stories of Black Jacksonville. I'm Ann Schindler. You've been listening to First Coast Connect on WJCT News 89.9.
Support for First Coast Connect is provided by Baptist Health and the North Florida TPO.
Proud supporter of First Coast Connect, Baptist Health, committed to building a healthier community for all of us. More info at 202-4YOU or baptistjacks.com. The North Florida TPO is committed to shaping our transportation future. We're focused on planning, funding, clean fuels, and new technologies for a vibrant, connected community. Learn more at northfloridatpo.com.
The Jacksonville Children's Chorus is holding auditions for kids in rising 2nd through 12th grades.